Welcome to The Kick, your expert-led podcast helping you explore and learn everything about getting pregnant, pregnancy, birth and becoming a parent.
On the podcast and our online pregnancy program, Grow My Baby, we share my experience of helping more than 4,000 babies to be born.
And our experience of running a women's health clinic and parenting 4 boys.
We're here to help everyone to feel empowered in pregnancy and birth with real-life practical information.
Welcome everyone, I'm Brigid Maloney.
And I'm obstetrician Dr. Patrick Maloney.
And today we're doing a topic that was suggested by one of our program members.
Okay.
Yeah. It's all about male circumcision for newborns.
Okay.
Yeah. It's a big topic, isn't it?
It is a big topic, and it gets people all upset. I think we need to talk about it as dispassionately as we can, yes. Pros and cons and so forth.
Yeah, well, I've tried to do it, ask questions from both sides, and this is a non-judgment zone.
Yeah. Yeah, I get asked about circs for boys all the time. And so I'm used to talking people through the pros and cons.
Yeah.
And then we get to the end, which I try and make as balanced as I can, right? And then we get to the end and there's this long pause and they're waiting for me to tell them what to do. And so that's the tricky bit. Yeah.
Yeah, that is the tricky bit. Because we'll discuss it in detail, but there's, so many reasons why you might be making that decision in the first place. So they need to be examined as a individual if you're just a solo parent or as a couple.
Sure.
So, all right, let's start with the basics. I think it would help people to know, things like how's it done. Do they use anaesthetic these days? Let's hope they do. The recovery time, who does it, that sort of thing.
Sure. So male circumcision is a practice that goes back thousands and thousands of years. It's been done various cultural groups over the world for religious and cultural reasons, and then in the last few hundred years, probably more for medical or perceived medical reasons. It's a little out of fashion in Australia at the moment. It used to be near universal. One thing that people worry about is risks associated with it. It's a very safe procedure. It's done with your baby awake. Typically, typically about a month to 6 weeks after the boy's born. It used to be something that was done in hospitals.
What, just after birth? Just after
birth, yeah. But government funders like Medicare in Australia and private health insurers have moved away from it as an in-hospital procedure. It's now something you sort of have to choose to do, find someone who does it and go and have that as a separate hospital admission.
And so who is that who?
In Australia, there are a number of groups that do circumcision. They're typically urologists or specialists of the urinary tract who treat various penile conditions in men, and they will often offer circumcisions. A small number of obstetricians do it in the private sector because they're the ones seeing all the babies, and they've gone and got training in the technique. And then a small number of various other medical practitioners, including procedural GPs, and then a small number of non-doctors doing procedures for religious and cultural reasons.
Okay, Patty, I did look at some of the websites that say they do circumcision, and somebody might be out of pocket about $250 to $600.
Okay.
Yeah.
So I think that public and health insurance funders have probably not really been in a great hurry to fund a procedure that they would say, well, if you don't want to pay for one, don't have it.
Yeah. So, Patty, can you briefly describe what happens during a circumcision?
Okay, so typically 4 to 6 weeks after the baby boy is born, we go to our circumcision provider. That might be a service they offer in their consulting rooms, or it might be a readmission to a hospital. And the foreskin is removed under a local anaesthetic block with a block that goes into the back of the penis. And I once saw a baby sleep through the whole thing. It's not painful, but it is, they can be distressed just because they're in a strange environment with their clothes off.
I did read on one of the sites that, sometimes mums can even breastfeed throughout the procedure too if the baby needs to be calmed down.
Yeah.
What about then recovery? What happens? Is there bleeding? Is that something that we're worried about?
Yeah, bleeding can happen at the time and is one of the risks of the procedure, and the clinic that does the circumcision will have a protocol for dealing with that. And then if bleeding happens later on, it would typically be as the result of infection. And if your baby's been circumcised, you should have a detailed handout that talks about any signs or symptoms of infection and who to ring and how to get hold of expert care if it happens.
All right. We'll go on to sort of if there's any risks later. But I thought maybe it might be interesting. I mean, I found it fascinating to know that there's different rates of circumcision in every country of the world.
Yeah.
Like, it's not universal. Some countries have like 99% circumcised, and the ones that I picked up on, like Afghanistan, Morocco, Palestine, those that are, and Israel, they're areas that are culturally and religiously
inclined to do it.
The United States has a much higher rate of circumcision than Australia. Theirs is around 71%.
Yeah, they used to sort of lead the world in the medicalisation of the procedure, and it was pretty much universal at various times in the 20th century. A lot of the data that they relied upon to support that practice has been seriously questioned in recent years. And their rates are coming down. Yeah,
their rates are declining. Like all high-income countries, the rates of circumcision is declining.
Yeah.
The country that I found interesting was South Korea. It was 75%, and it was thought to be because, and it's very different from other Asian countries.
Right.
Yeah, and it's thought to be because of the influence of the US during the Korean War.
Yeah, right.
And then later on in the 80s and 90s, it became fashionable because it showed people that they believed in westernised medicine.
I see, right. Yeah.
But that's declining now as well.
Yeah, okay. So all of this data shows how important this is as a cultural phenomenon.
Yeah.
We'll get on to the medical phenomenon, which is where it gets interesting. But there's no doubt it has come and gone as a cultural phenomenon, dramatically. Yeah.
The other place that it is either stabilised or increasing is in sub-Saharan Africa. So,
that's about the HIV prevention, right? And this is an interesting argument because sometimes it's trotted out as if it's universally true, and I have some issues with that argument, not whether you get circumcised or not, but I've got an issue with an argument that's logistically flawed. That's the nerd in me doesn't like that. It's definitely true that if you're circumcised in sub-Saharan Africa, there's less HIV transmission. But that would appear to only be true in a high incidence community like sub-Saharan Africa. And if you are in a low incidence community like Victoria for HIV, then your money would be better spent on safe sex practices than circumcision.
Yeah, safe sex practices like condoms or education. And
sure.
Yeah. Good. All right.
So it wouldn't. You may prevent several cases of HIV in your community in sub-Saharan Africa by circumcising all the boys. You won't prevent any in Australia. Yeah.
Do you keep dating the wrong people?
Are you a chronic people pleaser?
Maybe you want to know how to spot the narcissists in your life and what to do about them.
I'm clinical psychologist Dr. Anastasia Horonis.
And I'm Ashani Dante, and we are your hosts for But Are You Happy?
Bringing you all the self-development and mental health information you actually need.
But Are You Happy drops every Saturday morning.
Just in time for your hot girl walk.
Tune in because self-development is more than a matcha and a mantra. Brought to you by Medibank.
So let's go on to some of those medical points that people have said. So you said that the US led the way in medicalising it. Why did they do that? What's the medical reason someone might say, I'm having my son circumcised because of?
Yeah, so I think the thing that people sometimes mention is the HIV argument, which I think we've dealt with. They sometimes mention medical people sometimes mention that there's less cancer of the penis if you've been circumcised. That's another flawed argument, I think, because I think you're probably more likely to get struck by lightning than get cancer of the penis. It exists, but it's like super rare. So again, I'm not sure that widespread advice to circumcised boys just to prevent one of the rarest cancers is good advice either. But it's there as an issue. It's the cleanliness argument that gets mostly brought up. And a lot of people know somebody who either didn't take care of themselves with their bodily hygiene or developed a thing called phimosis, which is where the foreskin was left intact in the baby but got too tight as an adult. And that led to an infection, a bad smell, secretions being stuck inside this super tight foreskin, and then a pain associated with that as well. And the treatment for that, if it gets bad enough, is to have a circumcision done as an adult or as an older boy, when it's a bigger hassle, more of an anaesthetic challenge, and potentially awkward, embarrassing, and so forth. So it comes down again in my mind as to whether it's worth doing the procedure on babies just to prevent a relatively uncommon outcome in older boys and men. But that's certainly the one that gets put forward as the persuasive medical argument. And to be honest, I think what people are usually trying to do when they mention medical arguments is try and use the medical argument to justify a decision that they've already made on social, cultural, or cosmetic grounds. And what I say to my patients all the time is, you don't need that. If you want to do it, do it.
Yeah.
And if you don't.
Yeah.
But don't go looking for medical arguments to justify a decision that you want to make just because you think dicks look better with the skin cut off. Just do that.
Yeah. He's getting passionate now. Yes, and look, I have read more terms about a penis today than I care to. So
Sure.
You mentioned phimosis, and I didn't even know this because I actually thought that somebody had said you had to pull the foreskin down when you clean a little boy's penis. I never did because it just seemed ridiculous, didn't need to. But 100%, nearly 100% of newborn boys have non-retractable foreskin.
It's stuck there.
Yeah, it's stuck there.
Yeah.
I did not know that.
So you can't do it at the start.
You can't do it, no.
You can't do it at the start. But by the time they're older, but before it becomes awkward, then it's quite straightforward to teach them to pull the skin back in the bath, and wash underneath and then push back down again. Yeah. So that is not difficult, and it's just one of those millions of parenting things that people do. Yeah. So I don't think that I think that is easily. It's easy to prevent those problems most of the time without necessarily resorting to a preventative approach to newborn circumcision.
And those people that sort of cite a medical reason of, say, phimosis, like I also read that it's only 1% to 2% of adult males that have phimosis that might need circumcision or might need treatment later on in life.
Yes, I'd be surprised if it was 1%, to be honest. So I think that, again, that's a rare enough outcome that we should probably be concentrating medically on routine care of our bodies, washing ourselves properly. If it gets tight, for whatever reason later on, we'll treat that person, but not everybody. Yeah. So the vaccine argument where we treat everybody to prevent a small number, that's because the outcomes from vaccine preventable illnesses might be terribly serious. If one person gets phimosis, does that justify circumcising all the boys? Probably not. Yeah.
That is an argument, that is an ethical argument that some parents do use is that if they're going to vaccinate their kids, this is also a prevention that they know they can make that decision for as a parent of their child.
Oh, yes, and they've got absolutely every right to do so. I just think it's probably perhaps a little logically flawed in that the outcome that they're preventing is not the end of the world and could always be treated at the time. That's not the same as polio.
So that section of the podcast was supposed to be why someone might choose to circumcise. It sort of turned into why they might not choose.
Believe it or not, I might sound like I'm really for or really against, and I'm actually not. I just challenge people to have the courage of their convictions about it and say, if we're going to do it, let's just do it. And if we're not. But we don't need to make up reasons other than this is what we want.
One of the American Pediatric Association's recommendation, I think it's an association, is that it can lower the UTI risk in newborns.
Yes, in newborns, that's right. And I think that, again, that is... there's some varying data on exactly how well it works to prevent that. But let's say it does, and it does really effectively. That is still not a really common problem. And UTIs in boys are not terribly common. They happen. They can be treated. They can be investigated. And again, is it worth doing the procedure just to prevent them when it's not a common problem and it's not commonly a life-threatening problem?
Well, it's only 1%. Uncircumcised newborn rate of UTI is less than 1%.
Yeah.
Yeah. So it's all about that absolute risk that you've talked about before. Yeah.
Yeah, the important risk, but the important difference between relative and absolute risk. So you might hear, if you have procedure X, it halves your rate of getting cancer Y. And the problem is that the rate of cancer Y was 1 in a billion. And you've halved it to 1 in 500 million. Well done. Yeah.
Well, I think already we're onto the cons, but let's go on to, we talked about what the procedure is. Can we just talk a little bit more about what the potential risks or perhaps even complications might be from having circumcision?
Sure. It's a medical procedure. It has, therefore, the risks of medical procedures, which in summary are infection, heavy bleeding, potentially requiring transfusion. Babies are not great at dealing with overwhelming bacterial infections or a lot of bleeding. So sepsis, a widespread, very serious infection, I guess, is always possible. Bleeding requiring a transfusion is possible. An unsatisfactory cosmetic result is possible. And before the widespread use of the Plastibell system in Australia, there were plenty of people who wound up half out and half in.
Yeah.
And those people were typically quite dissatisfied with their cosmetic result. Yeah. We're used to the appearance of all out or all in.
Yeah.
Yeah.
And is it a myth that there's a loss of sensation?
I think that is probably true, that there is some loss of sensation. Exactly how much of a problem that presents is a matter of opinion. Yeah.
Hard thing to study something that's so subjective. Like, how would you even know? You'd have to have an adult who was sexually active that had a foreskin and then had that circumcision, and they're probably the only people that can tell you whether there's a loss of sensation.
That's right. There aren't that many people who've had both, who can tell you what it was like to have both. In particular, to have both in the years that they were sexually active, and there's such a wide variation in what people consider to be satisfactory sexual sensation that it's a little hard to say.
What are some of the sort of cultural or social norms that make people consider circumcising their newborn?
People talk about wanting them to look like the other boys, or wanting the boys to look like their dad, and people ask me that all the time, and I don't mind saying that if you want to look like most of the other boys, that would be an argument against it in Australia at the moment, because whilst it's still commonly done, it's well less than half. And looking like dad, I don't know that that's an important part of the father and son relationship. I don't think you are naked in the same room very often, if ever, in life. And so I don't know that is an important thing. Part of maturing as a father is when your son's different in all sorts of ways to you. I'm an Essendon supporter, and my boys go for Carlton, tragically, and that's just part of life. They're not you; they're somebody else.
I also think sort of family traditional values has a lot to do with circumcision as well. And this is only a story of one, so I don't want to scare people away from circumcision. But the reason why none of the boys are circumcised in our big, massive family, so I'm one of 6, and we've all gone on to have, 2, 3, 4 kids each. So, yeah, there's a lot of boys in that group. And the family story was that our mum's second child was a boy, and at 21 days after his circumcision, he got a bacterial infection and he died.
Yes.
So our family sort of folklore, values, whatever, is that circumcision... It's dangerous. It's dangerous. I couldn't have circumcised my boys even if I wanted to. It would have broken my mum's heart. Whether that was the cause of John's death or not, I really don't know.
Which we don't even know.
We don't even know.
No.
But that's that. Some people make decisions based on what their family stories are.
100%.
Yeah.
And even a less dramatic family story than that tragedy. There is pressure on new parents to do what their families want in this setting. And sometimes other family members are oddly invested in this decision. And they will be pressured to do it or pressured to not do it. And tragically, sometimes the family of one person in the couple is pro, and the family of the other person in the couple is against.
Yeah.
And somebody's not going to win. So there is in situations where there's pressure like this, I remind young first-time parents of 2 things. This is your baby and a decision for you guys to make. And we can smile and nod politely at the other people and say thank you for your input, but the decision rests with you. And secondly, this will not be the last difficult decision you'll make as parents. In fact, this is one you'll make and move on from and probably rarely worry about. But later on, there's decisions about schooling and healthcare and all sorts of things that you'll agonise over and still not be sure you got right later on and really think maybe if you had your time again, you'd do something differently. And this is being a parent.
Yeah. And things like, what school that you might choose for your kid, or where you live, or how much time you spend at work, or, lots of different decisions. Like you said, they make much bigger impact on your child. So, yeah, they welcome to parenting.
Yeah, strap yourself in. Welcome to parenting. Yeah.
I want to finish on a positive note. I hope it's all been positive, but I want to help parents that perhaps choose not to circumcise and they've got pressure from family saying, but it's unclean. And I want to just go through what it is to maintain good hygiene in a newborn.
Sure.
With a penis. Let's say, mum's doing a lot of the nappy changes or whatever. She's the one that's going to stay home for the first few weeks or months or whatever she chooses to do. And, she's never dealt with a penis in that way before.
Yes. That's right. This is the reality of looking after a baby.
So bathing, just water or mild soap. You're washing the penis, the anus, the scrotum. That's it. You're not inserting anything into the penis. You're not sort of trying to pull foreskin back because we've already talked about you can't.
Still stuck together.
Still stuck together. Changing nappies frequently, like making sure that the baby's not in a dirty nappy for too long. When you've got the nappy off and the baby's kicking around, it's a really good chance just to have a visual check to make sure that everything's okay, that there's no redness or any unusual swelling, or I'm going to make this an opportunity to say, or tightening of like a hair. It's one thing that I wish people knew about is the ligatures that can happen when a mum's hair or a person with long hair can wrap around a penis. It does happen. So all of these are great opportunities to check your baby's genitals, put the nappy back on and go, well done, Mum, done a good job.
Carry on.
All right, Patty, why would a male need to have a circumcision later in life as an adult?
Yeah, I think this is worth understanding because whilst it's not at all common, it would certainly happen from time to time. And those reasons might be that some sort of emergency like phimosis that we talked about where the skin gets way too tight. Other dermatitises, there's a condition called lichen sclerosis where the skin can get very tight and scarred. And, of course, there's people who change their mind or who grow up uncircumcised and want to be circumcised for some reason when they're an adult. Preference for the circumcised appearance, religious conversion.
Yeah.
And so there must be a marketplace for all of those things. But it's kind of a bigger deal to have the procedure as an older person or an older boy or an adult. There's more tissue, the organ's bigger, and then there's the awkwardness, embarrassment aspect to having the procedure as a grown person.
I'm imagining a lot longer recovery time and potentially stitches. Is there
Sure.
stitches?
Yeah, so there is if you're having the procedure as an adult. So the question then is, do we do it to babies just to prevent all that? And some people think, yes, that's a valid argument, fine. Other people say, no, the chances of them needing this procedure when they're older are not nearly common enough for me to do it preventatively.
All right, everyone. Well, I think we've asked all our questions. Thank you for answering those, Pat.
I hope that was useful. Sometimes people sort of say, so what should I do?
Yeah.
And that's, I don't think we're here, especially with this topic, to say what we should do. But I do encourage people to have a think about it beyond just the argument of it's one or the other is what we've always done.
Yeah, there's a bit of inertia, it's just what my family does, so off we go.
Or what my family doesn't do.
Yeah.
And have a look at the data each way and make a decision that works for you and your family.
Yeah, and for some people it'll be clear cut. They're Jewish perhaps, and that is so much part of their identity, or they're Islam and certain parts of Islam expect you to be circumcised.
100%. And when it came to something as important as your religious identity, you would never consider not doing the appropriate thing. But for the rest of us, there's a genuine choice.
Yeah. All right. That sounds like a interesting date night that you and your partner can have. Listen to the episode first and then go out and hopefully you're still talking to each other after. All right, everyone. Thank you so much for listening. Thank you for sharing with your friends, your family. It's a really great way of getting our message out. And if you have any other questions, just either put it onto SpeakPipe or jump into our DMs.
We love the SpeakPipe because we get to hear your voice, which is gold for us. Thanks for listening, everybody.
All right. Bye for now. Hey, even though Dr. Pat is, a doctor, and we get lots of other doctors and other experts on our podcast, I just need to remind you that this podcast is for informational purposes only. We share lots of medical insights and experience, but everything we talk about is general in nature and may not apply to your specific situation. Please always consult with your own healthcare provider for your individual medical advice when you grow your baby.